Hello everyone, I am Ravina Rajput. We all are aware that 6 months ago, WHO declared the spread of novel coronavirus a public health emergency of international concern after the infection in China spikes tenfold in less than a week. More than 650,000 people around the world have died from COVID 19. In March, the WHO officially declared COVID 19 a global pandemic. There was a complete lockdown in many of the nations in order to lower down the spread of the virus. But even the lockdown didn't stood helpful. The multiplication of the virus was on a large scale and still it remains unchanged. To completely eradicate this deadly disease, many vaccines are under trial. During the phase of COVID-19, we have witnessed lot many things as it has been 6 months into the COVID-19 world. We have witnessed social distancing being followed everywhere. People with masks on their faces, sanitization, lockdown, people performing yoga and exercise, taking self-care and many more. Over the time, COVID-19 became such a pandemic in which the world experienced the positive things like the pollution-free environment, people got acquainted with the technology and learned to work and study from home. While on the other hand, negative things like decline in economic status of nations, loss of lives, stress over the healthcare system and many other. The global health scenario in the COVID-19 world could be such that people would be more concerned of their health hygiene. Regular sanitization, social distancing would also prevent other normal bacterial or viral infections too. Practice of yoga and exercise would lead into fewer cases of depression and anxiety, which are more prevalent in the adults due to the changed lifestyle. Routine checkups would become a familiar practice. Cleanliness is one very important thing which would take into consideration, which would ultimately lower down the spread of many diseases. Even the susceptibility to disease would be reduced as the immune system would be taken care of. On the other hand, because of the constant lockdowns, people have remained close in their homes. So, they may develop physical conditions like obesity, which may in turn affect the cardiac health. Technology has brought the world closer and its use was maximum in the COVID-19 world. But excess use of technology could result in the health conditions like stress over the vision, problems of heart, anxiety, etc. So, we could conclude that post-COVID health scenario could be better one or it could be the more critical one. So, we all should now understand that in future also there could be such an outbreak. But we have to be more alert and we should continue practicing the good health hygiene practices which would keep the entire mankind healthcare and ready to fight anything which comes.